In a major medical breakthrough, a 3D-printed ceramic subperiosteal implant was successfully placed in a patient for the first time ever. The implant is intended to anchor dentures in an edentulous jaw. Fabricated in Austria, this innovation is part of the EU-funded INKplant project, led by Profactor, which aims to create patient-specific implants for elderly patients. Developed with and printed by Austrian ceramic 3D printing specialists Lithoz, this implant addresses atrophic jaws, a common issue in older patients who have lost teeth and subsequently jawbone. This approach eliminates the need for bone augmentation and reduces healing time by an estimated 75%. The surgery, conducted by Dr. Christoph Staudigl at Kepler University Hospital, used biocompatible zirconia and was completed in a single operation. After proving to be clinically stable 60 days after surgery, the fabrication of dentures has already begun. This marks a significant advancement in the rehabilitation of severely atrophic jaws. The design was a collaboration between the Medical University of Vienna, Kepler University Hospital Linz, BTI Biotechnology Institute, and BioMed Centre Innovation. Agensmed will manufacture the implant using Lithoz 3D printers, and a clinical trial is being prepared to systematically validate its efficacy.